Hey everybody. Hope y'all having a good week so far. We talked in the last class session. I had a really interesting conversation about gender health disparities. Today, we're going to be talking about age health disparities. All right. So again, thinking about the same sort of things, same sort of concepts of different health outcomes based by age groups, right? But we're going to talk instead of gender or race, now we're focused on age and the aging process and theories around that, and then the social implications and the social determinants and the social impacts. So, but just as a quick reminder first, walked through it in the previous class session, but we do have an assignment. So our first paper is due on Sunday, March 16th by 11:59. So just by the end of the day. And that's after the spring break as well. But just make sure you're on top of that and let me know of any questions that you do have. Again, walked through kind of the directions and everything. You can find that on the syllabus and the Moodle page, which is most updated, most frequently updated. So please let me know if you have any questions. But let's get into the medical sociology perspective on aging and age health disparities. So what we're going to focus on with this session, we're going to address the topic of age health disparities, obviously, but really focusing on the unique health challenges faced by older adults. So by examining the structural and the social and the policy related factors here, you're going to be able to have a deeper understanding of how these age-related health disparities arise and are even addressed within society. And so this session that we're going to talk about and all the readings for today draws on a foundational, practical research insight and the type of strategic goals that are aimed at improving health amongst older adults and their health outcomes. So that's really what the readings in this session focuses on. So what I want you to get out of today, and especially out of the readings as you go through them, is be able to define what age health disparities are and identify the primary social and biological factors actually contributing to these disparities. I want you to be able to explore the impact of the social determinants of health outcomes among older adults. Also want you to understand policy and research priorities in reducing health disparities in aging populations. And then would like you to develop a critical perspective on the ways that health systems address or perpetuate disparities in older adults. And again, think about things like medicalization of aging. It's aging as a natural process, but the medicalization of it. So we're going to get into that. First is just a quick introduction to age health disparities. So first, what are age health disparities? What do we mean by that? So age health disparities are differences in health outcomes and healthcare access that disproportionately affect older adults. So older adults often face unique health challenges due to factors like biological aging, your natural aging process, socioeconomic disparities that we've talked ad nauseum about, and healthcare inequities as well. All the things that we've talked about also impacting then that natural aging process, and those going together as unique impacts. And then there's a difference between chronological and biological age. That's really important to distinguish. So let's talk about that. So chronological age is, think about that as how old someone is in years. So if you're 28 or if you're 57 or you're 92 or you're 10, your chronological age is that, how old in years you are. Biological aging, on the other hand, is the physical and functional changes that occur with age. So biological aging can vary widely among individuals, leading to differences in health outcomes, even among people of the same chronological age. So again, taking in factors like how functional you are, your mobility, how your access to how you access resources, your kind of overall quality of life goes into the biological aging as well. Rather than chronological age is strictly the age in years factor. But there's a lot of factors that go into what is your actual biological, and what did your biological aging look like? So again, just a little bit more on age health disparities. These disparities are influenced by that biological aging process, of course, such as, think of immune function or cognitive decline. That is also a key impacts on biological aging, including socioeconomic factors too, like retirement status and income and education. Additionally, healthcare inequities, things like limited access to care or discrimination in medical settings, can worsen health outcomes for older adults as well. Again, think about that intersectional approach there. Intersectionality is crucial. The intersectionality or the intersection of these factors often results in older adults facing higher rates of chronic conditions, things like diabetes and arthritis and heart disease, or functional impairments and mental health challenges like depression and dementia, especially in those marginalized groups. Think of low-income and minority populations. Again, the intersection here is critical. So consider the biological aspects of aging as well as those social environmental factors that contribute to health disparities in older adults, that contribute to the overall health outcome process, the health process in your life and in others' lives. But think about how that intersects to create those age-related and intersectional health disparities. Sociological perspectives on aging and health. So this is, I'm pulling more from the Cochrane reading. There's a couple pages there in chapter 4. They talked about disengagement theory and continuity theory. So I just want to highlight both of these to start. So disengagement theory, you can see the definitions up there. The withdrawal from societal roles that can lead to isolation and negative health impact. So disengagement theory suggests that as we age, as people age, both society and the elderly person experience a mutual withdrawal from one another. So society withdraws from the person withdraws from society, and that society reduces the role of older adults, and older adults gradually disengage from social activities, work, and other societal roles. So really important concept that it's a two-way street, essentially, what disengagement theory is talking about, that as society gives older adults lesser roles and reduces the roles that they are expected to play in society. Again, thinking of roles and statuses and those conversations in our early session about sociology in general. As that happens, older adults also disengage from society itself, seeing them having a lesser role. And this process gradually leads to social isolation, and also leads to reduced social support and untimely or ultimately poor health outcomes, as individuals may experience loneliness and depression and limited access to resources. Now, continuity theory it really maintains that older adults maintain routines and behaviors that promote stability and adaptability despite these health changes. So in contrast to disengagement theory, continuity theory posits that older adults seek to maintain that continuity in their identity and lifestyle. And so even as they face health challenges, older adults strive to preserve their routines, social connections, behaviors that are familiar to them, which helps them to adapt to aging. So as a part of the adaptation process, it's not necessarily disengagement. It's that really older adults are focusing largely on their routines and all the things that are changing in terms of the aging process, creating greater stability in terms of their social standing. And so this theory emphasizes the resilience of older adults and how their health behaviors, really shaped by past experiences, can help them maintain well-being despite aging. So again, disengagement theory, talking about the withdrawal from societal roles that leads to isolation and negative health impact. Continuity theory, talking about how older adults maintain routines and behaviors that promote stability and adaptability despite these health changes. Just a couple of additional notes too. So think about limitations. So both theories have limitations to point out here. So for example, disengagement theory overlooks the psychological effects of social isolation, does not account for how individuals may resist disengagement. The theory also fails to recognize how some elderly people actively maintain social roles and contribute to society. The healthcare implications as well, I think, are important to identify, that both theories influence how healthcare systems actually view aging. And so if society withdraws from older adults, like it's talked about in disengagement theory, healthcare may become less and less personalized and focusing on treating medical conditions without actually considering social needs. And we know that with increased medicalization, that is absolutely the case. If older adults maintain continuity, again, now thinking about continuity theory, healthcare services may emphasize helping them preserve their lifestyle, offering more preventative care and chronic condition management. So thinking about how these theories are important for application in the real world, again, thinking about disengagement theory, making sure that healthcare does not lose the personalization aspect. That focusing on social needs is incredibly important. Then with continuity theory, understanding that is that we need to emphasize preventative care and chronic condition management, especially with older adults as well. So again, they're theories, but they do have really good practical impact as well. So think about how might these theories impact the way healthcare is structured for older adults. Think about those. So for instance, how does a healthcare system that follows disengagement theory lead to less social support or fewer community-based interventions for older adults? Or how does continuity theory encourage a system that supports aging in place and long-term care options to maintain independence? Again, think about the practical impacts of these theories. Got another theory here, and again, we're going to talk about biological versus social aging, but this really comes from the Barkin reading. There's just a couple of pages in Barkin here. But in this section, Barkin discusses the dual impact here of biological vulnerabilities and social determinants on the health outcomes of older adults. And the reading here is highlighting how aging involves both physical changes like slower recovery timelines and the compounded effects of lifestyle and lifelong factors such as socioeconomic status and race and gender. So those lifelong factors like that. So let's explain these a little bit further. Cumulative disadvantage theory. We're talking about here how disadvantages from earlier in life accumulate and exacerbate health disparities as individuals age. We talked about the cumulative effects of systemic racism and whatnot, right? We talked about that in the racial health disparities factor, very similar here, very related. So this theory, cumulative disadvantage theory, explains how disadvantages accumulate and build up over time. And this leads to greater health disparities in later life. So for example, someone born into poverty, experiencing limited access to healthcare and education or social supports, faces these challenges throughout their lives. As they age, these accumulated disadvantages contribute to poorer health outcomes, making them more vulnerable to chronic illnesses and disability and premature mortality. And so this theory emphasizes that early life conditions like those things, childhood poverty or lack of education, these set the stage for health outcomes in older adulthood as well, reinforcing existing inequalities and also reinforcing the need that we need to address these things. That to address health disparities, we need to address social conditions as well and social matters. Biological versus social aging. So talking about how aging is influenced by both biological changes and social determinants of health, like socioeconomic status and race and gender. So aging here, talking about, is not just a biological process. While biological aging involves physical changes like the natural decline in organ function or mobility decline, social aging, on the other hand, refers to how socioeconomic factors, social status, and life experiences influence the aging process as well. So social conditions like poverty, like racism or gender inequality can either accelerate or mitigate the biological effects of aging. And that shapes health outcomes more profoundly than biological aging alone. So we have to make sure we understand these things together to fully understand aging health disparities in that process. So there is this interplay of biological and social factors. So it's essential to really understand that aging is shaped by an interaction between those biological aging and social conditions. So for example, a person with chronic illness who faces financial instability may struggle more to access the healthcare they need, right? And so that just accelerates a health decline. Think of also a low-income older adult facing multiple chronic conditions. So think about how cumulative disadvantage works. Remember, we talked about that in the racial health disparity section too, that cumulative disadvantage. So someone who worked in maybe low-wage jobs for their entire life might have less access to healthcare or live in substandard housing and face higher rates of hypertension and arthritis and diabetes. Again, thinking about how that accelerates the aging process, accelerates those health disparities. So to understand aging more comprehensively, we have to understand that interplay and intersection between biological and social factors. There's some national goals for addressing aging health disparities as well. And this really comes from that National Institute on Aging. I think it was Goal F was the title. Because really what this reading does is the NIA, the National Institute on Aging, outlines Goal F is what it's called, as a strategic framework to address health disparities among older adults. So the focus of Goal F is on conducting research that explores societal and social determinants of health and developing interventions specifically designed to improve health equity among aging populations, designed around those social determinants of health. So the readings are good from a good institution, a good organization, showing how understanding the social determinants of health actually applies in really real world settings and in careers and in the future of health. So quick explanations here on each of these areas. So on the social, economic, and environmental factors talked about in this reading. So the social determinants, right? Such as income, education, and access to healthcare. These are central to health outcomes in older adults and for older adults, as they are in the other sections that we've talked about too. So these factors can significantly impact quality of life and life expectancy in all the same ways that we've talked about in previous class sessions. The NIA, the National Institute on Aging, emphasizes that addressing structural issues in society like economic inequality or limited healthcare access, these things are crucial for understanding health in older populations. So we need to address structural issues to address health disparities in older populations. Number two, research and understanding diverse health needs. So the NIA here, and through the reading, supports research focused on understanding the unique health needs of diverse populations as well. So including those who are racially or ethnically or socioeconomically disadvantaged. Research also here aims to identify the best strategies to promote equitable healthcare access for all older adults, regardless of their background and resources. So again, thinking about the diverse needs of our specific communities, thinking about that population health perspective, rather than that specifically public health perspective. Again, think about population health, where we're focusing on specific groups. Understanding that we need specific group tailored strategies here. So, and then three, targeted interventions. So the NIA outlines several targeted interventions here, such as community support and preventative health measures and education about healthcare options to help reduce health disparities. And these interventions they talk about really are aimed to improve overall health outcomes and increase access to essential healthcare services for older adults in marginalized, especially marginalized communities. So there's a role of these national initiatives here. That's a big component here. So national initiatives like the NIA's Goal F play a really key role in addressing structural health inequity. So these initiatives provide frameworks for policy change and research funding that really can make a tangible difference in reducing these disparities, right? I think that's really crucial to understand, that these national initiatives play a really key role, a more encompassing downstream effort initiatives. And then there's broader public health efforts here as well to discuss. So these goals are really part of a larger public health efforts designed to reduce health disparities on a population level, like promoting health equity and improving life outcomes for older adults across the nation. So again, these public and population health initiatives really critical, but they're structural issues, and it's important to understand the structural component here. Just the last couple of slides, a little bit shorter session today. I'm trying to get you a good break too as you head into the spring break. The social determinants of health and aging. So this comes from that U.S. Department of Health and Human Services reading. And this resource or reading focused on the social determinants of health that impact older adults, examining factors like housing and transportation, social support, healthcare access. And it explains how these determinants contribute to uneven health outcomes in aging populations, and provides some really good recommendations for addressing these disparities as well. So some of the key areas that are talked about in this resource. So housing and transportation. Safe and accessible housing is really critical, and that's what's talked about in this reading. It's really critical for older adults to maintain independence, to maintain safety, access to healthcare, overall health. It's really critical, that type of transportation or that type of accessible and safe housing. And so poor housing conditions can lead to falls, can lead to accidents and other health type of problems that can be really, really detrimental to the health of older adults. Reliable transportation also is important as it ensures that older adults can access healthcare and grocery stores and social engagement, all of which are vital to both physical and mental health. The second point there, social isolation and support. So social isolation is a significant risk factor for mental health decline and physical health problems in older adults. Statistically, it's a significant factor. So without adequate social support, elderly individuals may struggle with depression, poor nutrition, and reduced healthcare utilization. While engaging with a social support network can help mitigate these risks. So promoting well-being and healthier aging as well through these type of social networks and support networks and social support. It's really important. So how do we make sure that we're addressing the social side of aging as a determinant of physical health outcome, physical and mental health disparities and outcomes? So number three, healthcare access. Barriers like high healthcare costs and limited insurance coverage and geographical location. All these things can prevent older adults from accessing what they really need, the type of care they really need. And this leads to delayed treatment and worse health outcomes, all of which contribute to worse biological aging outcomes and, again, just poor health disparities and poor health outcomes in general. So addressing these barriers is a really critical thing to ensure equitable healthcare access for all aging individuals. It's really important to consider that. And then it's also, I think, we need to point out structural barriers and policy implications here as well. So let's talk about the structural barriers first. I really want to emphasize how social determinants of health, the things you've talked about, they create structural barriers, not just the type of personal individual decision-making type of barriers, but more structural barriers to health and how these, we need to understand how these barriers often exacerbate existing health disparities in these aging populations. Again, think of that intersectional approach. All the things we've talked about before. That's why I saved aging at the end, because everyone ages. So think about how aging impacts and influences and intersects with other identities like gender and race, sexuality, socioeconomic status. All those things are really critical to understand. And then policy implications. So I really want you to be able to connect that these social determinants, I want to connect the importance of understanding these social determinants to policy solutions. I want to emphasize the need for holistic approaches that not only focus on improving healthcare, but also address those social needs of older adults as well, right? So like the things we just talked about, housing, safe and affordable housing, reliable and safe transportation, community support, social isolation. We need to, when we think about addressing older adult health related outcomes, oftentimes the conversation goes to medication, pharmaceutical costs, type of doctors, access to doctors. Absolutely critical. They are important, but we need to understand housing, transportation, community support, and social networks. We have to address those things too to have better, more holistic and long-lasting outcomes for our older adults, our more seasoned citizens as well. So that's really critical to understand. And I get it. Most people in this class, right, in our late teens, early 20s, but think about the aging process. When you get 60, 70, 80, 90, 100, whatever that might be, think about that aging process and the need for more holistic change and holistic policy implications here. So again, we just talked, just as a quick summary, we talked about sociological perspectives on aging and how they impact health disparities, talked about a couple of theories. We talked about biological and social factors contributing to the age-related health inequities. We also talked about national goals that like the NIA and policy implications for improving older adults' health. And then we discussed the social determinants as critical factors of health disparities in aging, including policy implications and what we need to do going forward. So I just want to reinforce the importance again of that multifaceted approach to aging health disparities, and that addressing these disparities requires just that a multifaceted approach, but also collaboration between healthcare policy and things like community organizations. So that's it for today. But just a reminder again, spring break, enjoy spring break, and we will see you on the other end of that. Have a good relaxing break, recharge, have some fun too, and we'll catch you on when you're back. And then of course, If you have any questions about these materials and you want to meet one-on-one, please do. Please just reach out. We can meet whenever you'd like. Happy to do that as we have been throughout the semester. And just as another reminder, make sure to get your weekly discussion prompt done as well. All right. Thanks, everybody. We will see you next time.